But a lot of them basically say they want something that, a treatment plan that's going to be reliable and functional for the rest of their life. And that's where you pull them up and say, well, that's not necessarily the case because you hammered these teeth for the last 60 odd years. So they're already weak. And so that tones it down a little bit. But that would be the primary one. They're interested in functionality. Then not far behind, but it depends on the person and where they are in their life and how comfortable they are in their life. Whether they actually want the cosmetic side of it too, because all of these have got a cosmetic component, but whether they then want it to actually improve the smile. In most cases, there will be an improvement anyway, because just reshaping and making the teeth, we all want them to look nice, full stop. But they then might want to make them lighter, is the usual thing. And we try not to let them go too light, because that looks a bit silly. We've had a few over the past that have gone to what we call in the industry Californian white. And sometimes I show them the spittoon, which is the colour of a toilet bowl, and I'll say, do you want toilet bowl white? Okay. And then they sort of get the impression that maybe not the choice, and you explain that is outside the range of normal human brightness. And so I think that's pretty much it. The baby boomers want something that's going to function. They want to be able to eat, they want to be able to stay healthy. They want something that's maintainable. They have a preference not to have dentures. But that's not always possible. If they haven't got enough bone for implants or they haven't got enough money for implants, then you're going to have to look at plan B. And that's okay. I think that's a thing that a lot of practices, they tend to forget. We've got a whole pile of stuff from the past that we used and it worked. It might have had some compromises, but it did work. And the focus nowadays is to have everything on implants because that's the U-Butte thing. But those of us that have been working with implants for 30 years realise that, and we realised for quite a while, that implants that aren't well maintained, well designed, the execution of the delivery hasn't been spot on, are a very dangerous thing. So people can get into trouble very quickly with implants if the whole backup and planning and follow-up is not there.